Nearly 40% of the Kenyan population seek their primary health care in all aspects to this sector. We have also compartmentalized the health sector here uniformly between private and public into levels of care.
We are immediately already going to be getting specialized OP clinics in certain specialties, that is oncology and nephrology, which we're going to be upscaling. And through the training that we've just received, we are going to be having very highly trained staff in ER and ICU.
Our focus will be to upskill the people of Kenya. The Indian team, along with the Kenyan team, will work together to ensure that maximum number of people can be treated in Kenya and they don't have to travel outside Kenya.
But the idea behind this partnership is slightly different. It is not to have Indian surgeons come in and operate in Kenya and go away. The idea is really to upscale our staff, and hence the focus on the training.